21-year-old female, 3 years ago, she came to the office, lives in Toronto, and congenitally missing upper laterals and canines. And it's a problem because she had orthodontic treatment twice, and she did not want to go through orthodontic treatment again. So we have short teeth, very wide space to replace 2 teeth. So how are we going to solve this? So I asked the surgeon, Dr. Davis in Toronto, to please place the implant close to the lateral, and for sure, make sure that it's going to come through the cingulum. I thought she was going to place a 3.5, 4.0 implant. She ended up placing a 3.0 because she felt that was the best. So I'm not going to judge, not being at the surgery, if that could have been a wider implant, but prosthetically will facilitate, gives me more options. So we have a 3.0 implant. The patient had a provisional, and while the patient had a provisional for about 6 months, we did not do any molding or let just the tissue heal by itself. Patient came back roughly a little bit after 6 months. Once we get the tissue profile that we created with the provisional, on the premolars, we put a little bit of bonding to compensate for the missing canine and have only 1 tooth to be restored with the implants. In this particular case, we used the GC resin pattern because we had the tissue already molded. And the key was to have that implant. I asked for the implant to come out from the cingulum and to have enough running room. Maybe a little bit too much this time, but the problem is that this is a 3.0 implant. And the question is how we're going to restore it. We don't have a lot of options with 3.0, so it has to be a custom abutment, has to go through Atlantis, but we have short tooth, we have a wide space, and how is this going to be restored? It's going to be cemented temporarily. She lives out of the country. It could be a problem permanently. We have a problem. I need to touch up the bonding. Or can it be screw retained? So we created a tissue profile that we wanted for several months. And while this might be a little bit deep, it's something that we felt we could manage. So we have the design on the custom abutments through Atlantis. This is the gold hue. Here are the final crowns over the abutments. And this is the profile that was actually created over all the months that the patient had in the provisional. Maybe a little bit wider than we normally see, but considering the position where the implant was and replacing the 2 teeth, this was the correct profile. When we look at the margins, this margin is a little bit deeper than the other one. We would have liked this to be slightly more supragingival. Cementing a crown in the mouth could be a problem, so we decided to do this in the lab. So here we have the final restorations, the proper contours aesthetically, and we decided to cement it. So anyone that says that I'm very slow when I do things in the office, this move is going to prove that I'm not. Of course, it has been moved fast forward because we have only a few minutes. But this gives us the ability to have a screw retain restoration that's actually cemented without having the problem of excess of cement in the mouth. We clean it up in the lab, we're able to polish it, and be able to deliver a screw retain restoration on a situation where we had a 3.0 implant. This is the final restoration, and considering that the situation initial was far from ideal, we're able to move forward. Final restoration, it's healthy, and we feel that if we need to come back for whatever reason, we have options, rather than having something that was cemented. And that's the patient smiling. We did not do any tissue molding, we just let the nature follow its own course, and I'm hoping for the patient to come back to Chicago for a follow-up. But it's important to always be on the same page between the surgeon and the restorative dentist. So how something appears, it's always a matter of perspective.